Paul has been suffering from extreme anxiety and depression for almost 20 years.
There's no interest in the normal things that I was doing. It's just been getting steadily worse.
Counseling and medication have been unsuccessful. Today, Paul will undergo his 5th session of electroconvulsive therapy, or ECT.
ECT is akin to rebooting a computer. So sometimes we have our PCs freeze and we have to shut them off before they can come back on. ECT probably does something similar to a patient's brain.
Electroconvulsive therapy was once called electroshock therapy, and it brings to mind for many of us the negative images of actor Jack Nicholson in the movie One Flew Over the Cuckoo's Nest.
I remember the movie very well. And I think it set back mental health in California. But it's not like that.
I ask you to take a couple big deep breaths and pick out a nice pleasant thought or dream, and we'll see when you're all done, okay?
UCLA has one of the largest ECT programs on the West Coast and one of the most respected. ECT takes about 20 minutes. It is now done under anesthesia and with muscle relaxants to keep patients safe. Patients are asleep for the session. A small amount of electric current is applied to the brain to induce about a 30-second seizure. The only physical sign during treatment is a slight movement, usually of the right foot.
The seizure that occurs with ECT is not like the pathological seizure that occurs in epilepsy. The seizure that happens in ECT is quite therapeutic, and there is no evidence that a seizure as applied in ECT promotes any kind of brain damage. ECT is the most effective treatment for major depression known to exist.
ECT helped Vietnam vet John Wyatt overcome suicidal thoughts related to post-traumatic stress disorder.
Like I say, ECT helped a lot because it's kind of like started getting, a whole lot better because I started taking the showers and shaving and the whole bit. And I wasn't doing all that stuff before because I was just so depressed. They made you feel like you wanted to live, so.
Orlando Skandrick suffered 5 years with paralyzing treatment-resistant anxiety and depression.
I didn't want to do anything. I lost all interest in everything. You just can't imagine, I don't know how many times I heard, just snap out of it. Nothing's wrong with you, snap out of it.
This is me when I first got back to work.
Orlando, too, underwent ECT at UCLA.
I work on oil rigs.
When I left UCLA, I told the doctor I wanted to go back to work, and he just couldn't believe it. He said, "You serious? I got peaks and valleys, but I'm able to pull myself out. I'm able to pull myself out."
UCLA is at the forefront of ECT research. Dr. Espinoza and Dr. Catherine Narr have been awarded a major grant from the National Institute of Mental Health. Using the most sophisticated brain scans at UCLA's Laboratory of Neuroimaging, they hope to one day predict who will respond best to ECT and who will suffer a relapse of depression after a course of ECT.
One of the things we know about ECT and the likely reason for its being one of the most effective treatments for depression is that it can change brain chemistry, blood flow, and the way different brain regions communicate with each other.
So what we're hoping in the future is that we can use these advanced imaging techniques to predict how a patient might respond to ECT in the future and if they might benefit.
There are side effects to ECT. Mostly it is short-term memory loss. Patients often come 3 times a week for about a month. UCLA treats up to 20 patients a day.
We see folks who are doctors, lawyers, actors, directors, nurses. We see everybody because depression is an equal opportunity offender.
I love my job. When patients come in catatonic, so depressed, and the ECT helps, it's amazing, the person that's inside there.
Thank you. Everything went fine.
Good.
You did really well with your treatment, and you're getting dressed and you'll be ready to go home.
Okay.
Thank you.
Okay, see you next time.